This is Ben Mokgoko from Soshanguve. Just over 4 years ago, he began to experience a number of symptoms that made him worry about his state of health.
I end up, going frequently to the toilet. And then as a result, I must drink water. I'm always thirsty. I end up getting sick, not knowing what causes that sickness.
After visiting a doctor and undergoing some tests, Ben was diagnosed as suffering from type 2 diabetes. When we eat, the body breaks down the food into glucose and other nutrients, which, with the help of the hormone insulin, get absorbed into the bloodstream and then into the cells. But for patients like Ben and the other 347 million people worldwide that live with type 2 diabetes, the glucose can't reach the cells. Instead, it stays in the bloodstream, causing dangerously high blood sugar levels.
Usually, I used to drink a lot of tea with a lot of sugar. These sweetie cakes, scones. So this thing they contribute for, if you are diabetic, they contribute for your sickness. So now it's vegetable, a lot of vegetable. I'm eating fish, beans to replace protein.
Since Ben's diagnosis, he has had to drastically change his diet, swapping fatty fast food for healthier, less sugar-rich foods. There is a strong link between type 2 diabetes and obesity because excess fat makes it harder for cells to respond to insulin. In addition to changing his diet, Ben now relies on his twice-a-day dosage of metformin tablets.
After taking my pills, I can feel it in my body, in my mouth, that my blood is okay.
If left untreated, diabetes can have devastating effects like eye disease, heart disease, stroke, and foot disease, which can lead to gangrene amputation. Mindful of this, Ben meticulously cleans and inspects his feet.
When you're washing your feet, you're looking for the source, You are healing for the source. It will take time. And then if you don't look after, your source will grow, and then as a result, you end up being amputated, you see.
In line with trying to embrace a healthier lifestyle, Ben now visits his local clinic once a month to check his weight, blood pressure, and his glucose levels.
There is a small sort of a needle. When you press it, it's like a small little gun, and it's sort of prick you very fast. Blood will ooze. It's just a small drop, and then you take the stick into that small machine, and then the machine will say and indicate to you the level. If it's between 9, 11, 12, it means you are fine, and then that is the correct number which is needed by the doctors. If it's more than that, like 15, it means your glucose is too high.
The World Health Organization projects that diabetes will be the 7th leading cause of death by 2030. For Ben, his diagnosis has been a wake-up call, and he is now committed to adhering to his treatment, lowering his salt and sugar intake, and leading a healthier lifestyle.